7:38. Let's actually go to the phones now, where we are joined by Superintendent of Education Jon Fernandez. Jon, thank you so much for joining us this morning. Good morning.
Yeah, today, Chris and Sabrina. I am on the road, so hopefully our connection stays good when we're talking.
Right. Let's just get right into it because I'm sure maybe your phone's been blowing up, but I know certainly ours has been. Parents just really, really concerned about the news about the positive cases within GDOE, and we're talking about students. And so first, let's just give you the opportunity to kind of address those concerns.
Well, first thing I would say is that we're well aware, I think, as a community, of the rising cases in the recent couple of weeks. So to know that there's about 400 active cases in isolation, it's highly likely that of course you're going to see a positive case within the school system of 28,000 kids and 4,000 employees. So it's never been a situation where we've thought that we would never get a case in the schools. In fact, we've been very active and transparent in reporting them so that everybody knows when there is a case. So obviously we started the school year last week, and in the first couple of days we were able to identify positive cases that came to our attention, and right now we are addressing those cases through contact tracing, quarantine, and testing like usual. So what the message I want to make get out there is that we definitely know there's a likelihood of having cases in the school system, and our job is really to contain and prevent the spread of the virus. And so at this particular point, while we do have 7 cases, 5 of them are separate cases in different schools, and then we have 2 separate cases in Unsalon. So it's not like we have 7 cases in one particular classroom, which would be concerning. We mirror the community, and we have a case, 1 case in 7 schools. I mean, this is on a school basis, on a school by school basis. For those schools that have been affected, we're still talking about 0.1% of the population being identified as positive. And what we're working on is ensuring that we don't have any indication of spread of the virus. So that's where we are. I've talked to our administrators. We know there's people reacting about the safety of the school of students and teachers. And at this point, from my observations at the schools and from my look at the data, we don't have any indication of any spread of the virus. And in fact, we are seeing high compliance across the schools in terms of the safety measures to really help us in containing any potential spread. So right now we're activated. We're in constant touch with each other and with public health, and I think we've taken overly cautious measures at this point, just because we're phasing in, to try to just ensure that we identify any potential contacts and have them come in for testing and clearance before they return to school. So that's where we are right now, and this is not a surprise for us. We expected that, given what's happening in the community, you will see a case that comes up, at some point at a school, and our job is to deliver an effective response.
Right, Jon, can you just walk us through what happens when a student or someone at the campus tests positive? What do you guys do?
Well, when we are aware of a positive test, and of course, in these first couple of days, it's obvious that the virus didn't come from the school. I mean, it's only the first day or 2 of the school year when we started to get indication of need for testing and positive, and then a positive result this week. So, but once we get a positive case, we definitely have to confirm this with public health, and so we're pretty good at getting that confirmation quickly, and then we go through the contact tracing. In this situation, just to be frank, we just since it's the beginning of the school year, we have identified for the elementary schools, for instance, the entire class we notified, as well as the teacher, for the purpose of testing and quarantining. And so that's what we're doing, even though the guidance really is to focus in on those who have, who are within the 6 foot distancing for a prolonged period of time, over 15 minutes altogether. So we didn't actually, rely on that narrower definition. We just said the whole class. Let's just see how it goes in terms of testing the whole class and the teacher, and then we will, slowly improve or refine our approach as we get more data. So that's what we've done in the elementary schools. In the secondary schools, it's a little bit more disruptive because we've actually notified the entire team of teachers to go ahead and test, arrange for testing, so that we're clear about the teachers being okay, and then also all the students who were in the classes that the ones that the index case was in. So, again, as you know, in middle school, you don't stay in the same classroom. You go to different classes or different students. And we've taken a very wide, broad approach to requiring testing and quarantining. And based on the results, we'll determine what further action is needed. I guess the other aspect to that is, it happened. I think some of the things that we're kind of working through is that we know very well, and at this point, we know that the role of our social workers is going to be important, because as we went through our listing of students, there are certain, families that were harder to reach. So we did mobilize our social workers to immediately address those families and notify them, so that we can prevent the students from having to come to school, and they can be notified while they're at home. So our social workers have been deployed, and so we're going to look at that continued role for them, given what we've seen in the first couple of days.
John, we had a concern that was expressed by a listener about a family member who was exposed to COVID, sent home riding the bus, wasn't informed. The guardian wasn't informed until hours later. Just kind of going back to that protocol, is the department doing anything to kind of close those timeline gaps?
Well, again, the issue is being able to identify the positive and the close contacts. And in this case, we were working over the weekend and Sunday night to start that process, and into Monday to identify all the students who need to be contacted. And that contact went directly to the parents. So I'm not sure about that situation and what that, with school and what, but we're looking closely at the response mechanism. In this case, what we realize is, working with public health, is we're taking an overly cautious approach. So that means a lot more students that would normally need to be identified in contact tracing are being identified just to be extra cautious. But really, we've exceeded the guidance in response, with regard to our response. We consider this like a phase-in stage where we're testing our response and, again, being overly cautious and then looking at the results as we get them from public health.
John, can you just clear this up for me? So if a student tests positive, is the entire class quarantined?
For now, that's what we're doing, and it's been public. I guess working with public health as we started this year, where again the issue is detecting and preventing the spread. So the recommendation for public health was to go ahead and quarantine the whole class, but over time we will see that change. So one of the critical issues that we have to get established now that we're into the school year are things like the seating arrangements. So in the first couple of days, when the kids are coming in and they're just establishing their seating arrangements, that's a little bit more difficult to do in the first couple of days of school, to say that we can rely on an established seating arrangement to identify who the close contacts are. So, every school is providing that seating arrangement so that we can do a better and a more targeted job of contact tracing. But in the first couple of days, especially with secondary students who add and drop classes, we didn't want to just rely on the seating arrangements for this immediate response. As we get into the school year, though, what we will be doing is using those seating arrangements to identify the close contacts and focus in on those students and teachers specifically. And I think that will help the process along.
How many days quarantine are we talking about, John?
I always rely on our nurse to be the one to give the result. But my understanding is that it's a 10-day quarantine as a default. If they get tested, the kids who get tested and come up with a negative will be able to go back like at day 7. But normally, if you are quarantined and you don't get tested, you have to be home at least for those 10 days.
Wow.
So it's really a 7 to 10-day range. And, our school nurses are really the ones who we tell our families to get that official information.
Right.
Because as the guidance changes or varies, we want to make sure that, we're following.
So they get like 7 to 10 days worth of schoolwork to take home?
Or does it switch to distance learning at that time?
Yes. So, my understanding of the schools that have been affected is they've been able to, provide the Google Class links for students to be able to transition to online, including the support for the laptops, et cetera, for this period of time. So, again, we haven't had to deal with this at this scale, for the past 18 months. So a lot of what we're doing, is part of our plan. But of course, this is the first time we're really executing the plan at this scale. So, we're really monitoring it closely and ensuring that we, look at what we can improve as we go forward. But
John,
yes, the schools have been quick to set up the Google links and get the kids transitioned over while they're out.
Just a couple more questions. What is the department doing to better address the social distancing? Because I know you saw the pics from and granted it was the first day of school, but we still get some comments about class, the closeness of students in the class and that kind of thing.
Yeah, well, first of all, like I said, it's very, you have to imagine how difficult it is to really teach students their distancing requirements and all the rules when they're not in school, right? So the first day, kids coming back, a lot of the efforts of our teachers and staff and administrators was really focused on getting them in and then organizing so that we could communicate with them those rules and those, and the parameters and the consequences and all of that. So, it really isn't fair to use day 1 as an indication. I think, I went around day 2, and especially to the schools where I heard some of that noise. And the schools are adjusting, making those adjustments. In fact, Ukadu was one of those schools that on day 1 there was some concern that kids were in the gym and they weren't distanced. Day 2 they were organized into 3 cohorts for lunch, and and for in the gym and in the cafeteria, and it was an immediate effective adjustment made based on being able to communicate with the students and let them know that this is how things were going to work this year. It's very hard to do that when they're home and then over the summer, no matter what we do.
Right.
So it was really important to get them in, work through the protocols, and so forth. I think the same thing with the parents and the drivers. We are encountering a high number of car riders, so schools are really working to figure out how to make the adjustments needed so that the flow of traffic is better. But we've seen that there's some of those traffic issues in these first few days, mostly because the car riders have doubled, if not, multiplied more than that. So that means we have to, adjust traffic patterns and, into the school and out of the school. So we'll make those adjustments. I've seen improvements already in just the first few days, but it really has taken us, really required us to get back into it so that we could see how things actually turn out and then begin those changes. I do want to say one thing on the distancing and all of the other safety requirements. It's a lot of it's just common sense. The virus, is a threat if it gets into your respiratory system. That's why the face masks are fundamental. If you're not vaccinated, especially, but vaccination is what we're looking for everybody. But if not, the face masks are really fundamental to limiting the risk of the virus getting into your respiratory system. And so the face masks, based on my observations, a high compliance rate. I didn't see any issues with students coming off the bus, students going to school, walking through the school or in their classes with the face mask. But everything else, hand washing, cleaning the surfaces, physical distancing, all of that has to do with, not getting that virus in the air, on your skin so that you can transmit it through your mouth and through your nose and and so as long as those face masks are on, I feel comfortable. And then with the other safety measures, we're going to continue to work to address and improve. So, I think that's something that we just really need to think through as to where the risk is in terms of transmission. And I have to say, even though there's the debate about masking that I see in the States, I am glad that our elementary school kids, middle school kids, and high school kids don't have an issue at this point with following the rules.
Right. John, I wanted to just go back to, I think we had asked you this last week about the online learning option as if we continue to see this surge climb, and obviously if we get more positives in the schools, whether or not there's school transmissions, anxiety levels obviously going to rise with the parents. So are there any plans at all to revisit your decision to close off the online distance learning option for? Go ahead.
So so again, for me, what I'm monitoring and then looking at is transmission of COVID-19, because the whole issue around schools opening has to do with whether or not schools will contribute, to the spread of the virus or be what they call super spreaders. And that's our concern. And so long as we don't see that spread, we believe that that's evidence of our ability to address cases that we see safely and effectively. So that's what we're monitoring. If it comes to a point because of the community situation, right, because of what we're seeing at the karaoke bars or what we're seeing with people on base, making up half of the cases that we saw early on in this recent spike, or opening of restaurants and grocery stores. If we see that in the community contributing to the high rates in the community, we would guess that there would be a higher level decision about what's open and what's closed, right? So with regard to the schools, I think at this point, our job is to do our job, get our kids in school, make sure that we don't have any incidents of spread of the virus. But if the community, goes in a different direction, in terms of the spike of cases, then I'm sure the governor and I will be speaking about whether it makes sense to keep schools open. My message to her is close the bars, restaurants, and grocery stores first, and then we can look at the schools if we're concerned about all the rules that have been relaxed. Right. Otherwise, let's continue to do what we need to do to keep ourselves safe. Get vaccinated. I mean, the protection for kids. We care about our kids, and we need those adults in those families to really evaluate their options in terms of getting vaccinated, so that we can all work together to protect our students.
What about hard copy, John? Because I know you said online requires moving of students to different teachers that are already kind of locked in place. But we did have a comment from a listener who says hard copy, we can pick it up.
Yeah, I know. I don't know. I mean, I won't say the specific schools and so forth, but I do know that in the discussions we've had that there are hard copy available that could be made available for those classes that are being affected. So it would really be through that teacher in that class to make those available should online be an issue. But remember, we do have the laptops available, the MiFi devices, and so forth. So our first effort is going to be to transition the kids online. But if that's not going to work, I know that I saw in our chat, teachers are preparing the possibility of hard copy lessons to go to those students.
John, just real quickly, what's the average class size?
The average class size is going to be kind of in a normal range. So I would say that in the classes I visited, you see about 25 students in class. They're all within that 3-foot distancing requirement, meeting that 3-foot distancing requirement. Use of face masks. I've been really pleased with regard to the schools and the classrooms that I've seen The challenges that we are having, of course, and that we're observing and trying to work through is what happens during the break times and the transition times and so forth. So, that's going to be the adjustment that needs to be made. And when we're working with the schools to address, what happens during recess or during lunch, to make sure that we supervise and enforce the distancing requirements. But what's good about about most of our schools is that, during break time they're outdoors, and being outdoors is going to be a much more protective situation than being, in an enclosed space. So for most schools where you're outside and you are able to have some room to spread around, and that's okay. Now with the rains, that's been an issue, right? This, with the weather, when the weather is, challenging, they can't do that. So, again, with the schools, collaborating with us, we're looking at what solutions might help them to address those situations.
Mm-hmm. So just to clarify, we have 7 students that tested a positive, but if there's almost 200 students that are in quarantine.
Well,
that
I don't
aren't.
have the exact. I don't have the exact.
No,
numbers,
but I mean,
yes.
if based on
Yeah,
on average, if it's 25 and there's 7 students, multiply
Well,
that. So, right
I would
there.
say there's more than that at
Okay.
this point, because of there are 3 secondary students, right?
Mhm.
So if you are in an elementary school, yes, it would be your class of 25 students, 25 to 30 students maybe at the most. And then if you're in a secondary school, what we've taken a very broad approach. And so we're going to have to relook at this, but we basically said if you're going to be in 6 or 7 classes during the school day, we want to notify and test those students. So you're multiplying. That's almost 140 students in those 2 schools, right? Antolon and Benevente. Again, this is phase 1. We're going to see how it goes in terms of testing and in terms of what we're learning. But we already discussed in public health that once the seating arrangements are completed for the secondary levels, we can go to that 6-foot distance for close contact.
Well, thank you, John. I know we've got to keep the show going. There's a lot of comments here. Hopefully, you or any of your deputy superintendents might be able to take a look at it and maybe hopefully address some of these concerns on our stream.
Yeah,
There's quite a few.
Yeah, we'll take a look at it.
Yeah.
But again, I can only do so much to let everybody know what we're doing, and we plan to do that. We plan to be as transparent as possible. We do know there's a lot of fear.
Mm-hmm.
We do know there's a lot of anxiety and a lot of uncertainty out there. And what we're doing here in the department is making sure that we educate ourselves about the virus, about the transmission of that virus in school settings. We're learning from what other districts have done and what their results have been. And what we've learned is that so long as we have these multiple layers of protective measures in place, we stand a strong chance of limiting the spread of the virus in school settings. In fact, we even saw a recent U.S. News report on a study that showed the same within the school bus environment, that if you have your mask and if you have you're able to open those windows a little bit to facilitate the flow of air, that the transmission of the virus was minimal in the school bus settings. So what we're learning and what we're trying to ensure that we implement is really based on studies and based on research of what has happened over the last 18 months in school districts that have stayed open. So that gives us confidence that we have taken the right approach, that we are taking an approach that has been demonstrated elsewhere. But of course, every hour, every day, we're going to be tracking the numbers to make sure that we are on top of our situation and our response. And that'll be our continued effort and our commitment to our families.
Thank you, John.
Thanks. All right. Thanks, everyone.
Okay,
Thanks,
we'll see
John.
you. There you go. Superintendent of Education, Jon Fernandez, there with a good 30 minutes of information. Guys, it's 8:03. Yeah, there's a lot to unpack from that. It sounds like there's a lot of students on quarantine.
Well, if the average, what he said was around 25,
Yeah.
7 students test positive, you multiply that. I think it was almost 200, but he said that it's more than likely more, because I think when you go into middle school, don't you like switch classes,
Yeah, you do.
right? Yeah. But in the chats, not in the well, in the chat and on this live stream, definitely a lot of parents are concerned. One writes, "My child's teacher claims she did not need to use her mask because she's vaccinated. Masks should be mandatory for everyone due to the possibility of spreading the virus to our children, especially our unvaccinated children." Masks are mandatory no matter what, I believe, GDE, if you're vaccinated or not.
Yeah.
And that's something that you probably should let...
Address with your school's administrators.
Mm-hmm.
Yeah, that's crazy.
Why do you continue to make it look good when you know that social distancing is really not happening? Yeah, look at it when all the kids get sick. You're full of it. Quit risking the children's lives.
We're KUAM FM. I got in Guam on the breeze. But due to some technical difficulties, we're just going to jump on to KUAM TV without all the theme music. So let me know when you're ready, sir. Boom, boom. Morning, KUAM TV. Morning. It's 8:05, Tuesday, August 17th. This is The Link. It's brought to you by Pacific Points, Calvo Enterprises, IT&E, and Jack in the Box. We're going to take a look at news, and we're also going to kind of unpack this interview we just did with Superintendent Jon Fernandez, who was able to jump on this morning. Just really amidst, I want to say there's a lot of, I don't want to say tidal wave of concern, but there's a lot of concern from a lot of parents. And Jon mentioned the fear and the anxiety, which is totally normal to feel at this time, especially when you turn on the TV and you see what the Delta variant's doing in the States. And when you turn on the Link and you hear Dr. Hoa say that we're in the midst of a Delta surge. All right, so you're totally justified. I think the challenge really is for like anything with the schools and their protocols, is to come up with a plan that's flexible, right? Because obviously it's only been 3 days of school, so Jon does have a point where a lot of this transmission is possibly coming from the home. Dr. Ho, one of the Physicians Advisory Group, was just